So, Lisa, we've talked about why thyroid is important and who suffers from it and the kind of general health treatments. Let's talk about how the thyroid will impact hair and what kind of symptoms you would typically see and feel in a client and how they are supported.
Okay, so typically we see things like excess hair shedding, um, very dry, coarse, sometimes even brittle hair. Um, you may be feeling that your scalp feels tighter or quite dry. Or in other cases, sometimes you can have a more oily scalp and kind of really excess shedding, especially if it is overactive. So that's very typical in the clinic.
Yeah. And how do you go through and diagnose a condition with a client who is showing those symptoms and then looking at treatment pathways?
So in clinic, we would always recommend a blood test. And we also offer a blood test through Root Cause Clinical, where we look at 5 different markers for thyroid. So as well as looking at the general ones, TSH, T3 and T4, we also look at the 2 different antibody ones, which unfortunately not all GPs will do. But they will often tell us if we have subclinical thyroid levels as well.
And when that diagnosis is done, what are our next steps in terms of general health? Is it a referral, and then also in relation to the hair health?
Definitely a referral if your levels are out of range. As trichologists, we would not be able to medicate with any products, any medication like that. So we definitely refer you back to your GP. If the levels are subclinical, it would really generally be just guidance with holistic therapies like nutrition and lifestyle changes. So that's really where we would focus.
And would there be any treatment pathways for the hair itself, or does our role end with the referral back to a GP or nutritionist?
No, absolutely not. So we're working alongside the GP. Once you can balance your thyroid levels, obviously alongside your GP, we can help with your hair loss condition as well. So there's certainly medication, pharmaceutical products that we could advise you to use, or just support you alongside with your nutrition and holistic therapies.
So, in conclusion, then, what would you recommend if somebody had concerns about their thyroid, and or if they've got any hair shedding and they are concerned that it might be related to the thyroid? What would you recommend?
I would definitely recommend to come and have a diagnosis, find out the type of hair loss condition they have, and then go and either see their doctor or via us have some blood tests to find out their blood levels are.
Super. So, book an initial consultation online today. You can make a payment plan and do it in installments and speak to a trichologist to get a thorough examination of your hair health and get a proper likely diagnosis. Thanks today for talking about thyroid health, Lisa, and let's go on to the next conversation.
Perfect. Thank you.